Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of Geriatrician Dr. Andy Mencia. That's what I was doing.
Well, good morning.
Hello, good morning. We have so many things going here.
We keep it rolling here.
Oh, that's right. All these beautiful women that continue to come to this
AGI,
show. Yeah, AGI. I don't know where you find all these lovely women, but they're talented.
I told you my secret. I told you I go to Las Vegas. I saw Mrs. Dina Garcia there. I said, Dina Garcia, how you like to be a nutritionist? She said, no, I'm a dietitian. I said, even better. Come on aboard.
Well, that's a good point, and I just want to introduce you. So, Dina, what is your last name?
Garcia.
Dina Garcia. When he said that, I thought he was being funny. Dina Garcia is a beautiful name. Dina Garcia. That sounds like a TV show. Dina Garcia, right?
Yeah. Yes.
So,
like
Dina, what is the difference in a nutritionist and a dietitian?
That's a good question. So a nutritionist is a national registration, and the term nutritionist varies from state to state. So in the state of Florida, by law, you have to be a dietitian to call yourself a nutritionist. Although some people don't necessarily follow that, but that is supposed to be the law in Florida.
So you have to be a dietitian first to be a nutritionist.
Right, to get licensed by the state, yeah. And part of that licensure encompasses the name nutritionist. So if you're not licensed by the state, you're not supposed to call yourself a nutritionist.
You're right. It is used very casually.
It is misused, extremely misused. And you see people that have taken course on weight loss or diet or what have you. And they call themselves nutritionists, and they work as nutritionists, but they are no full licensed dietitian. So it's a big difference. Because
you go to a lot of the supplement companies, and they always say, well, we have a nutritionist to talk to you. They're probably just a salesperson.
Right.
That's selling,
well-educated,
right? I think that's true.
On the products.
That they don't really have these skills.
Absolutely.
Just sell these things, sell more of these, right? And they're good for you, and they read their brochure. Yeah. So you have to be very careful. So it's a licensure.
We have too much vitamin C.
Right, sell it.
Sell it. Push. Push that fish oil. Get it out.
You know, I do want to ask you a question. It has nothing to do with that exactly, but I have a dog that I've been giving vitamins to.
Okay.
And I went to one particular place to buy the vitamins, and now they've stopped producing them. I went to some other places. They're not making the dog vitamins. I wound up finding them now. Why is that a problem? Do you have any idea?
I have no idea. Pet nutrition is not my specialty.
Well, maybe we're going to do something. You know, Dr. Mencia, how many people have pets? We got to find a good vitamin. But anyway, I did find one. It's full of greens and lots of things inside. And when I buy all my vitamins, of course, from Dr. Mencia, and when I open the vitamin, you know, like our vitamin D, and, you know, it makes a little noise. My dog comes there and he, ruff, ruff, ruff. And that's so I have to give him a vitamin. Right. And I give him the vitamin, and he loves it. But I think vitamins are important for dogs also.
They are. Yeah. They are important. And you see dogs as they age, you know, they do develop osteoporosis. They break their bones. So
if you find a good vitamin, I'll buy it from you, and maybe there'll be other people buying it.
And, you know, the same thing applies to dogs that apply to humans. If a dog has a well-balanced diet, then you might not have to go so heavy on vitamins for your pet. But if the pet does not follow a good nutrition, then you have to supplement that diet so they don't get sick on you.
Oh, I didn't realize that.
Yeah.
So you say I don't need to have all my vitamins that I take?
No, well, no. If you follow a great diet, you don't have to over push. And that's what I love about the dietitians that work with me. You know, that they are there. We have product for the convenience of the patient. But right now, we have 3 dietitians working with us. And, you know, they all have different approach, which is great. It's like having 3 doctors working in the same office, right? Everybody going to have their approach. And Dina have her approach. As a matter of fact, she had created a diet that we're going to talk about that had been her creation. And it's called PF3. And Dina, you can tell us a little bit.
Protein, fat, and fluid.
Fiber
right?
and fluid, So PF3 is just an acronym to make it easy for people to remember what are the main components that I should have at my meal, which is protein, fat, fiber, and fluid. And part of the reason that I created this one was because I used to be pre-diabetic. And so I wanted something that I knew was going to stabilize blood sugars. And even for people that aren't having blood sugar issues, maybe they're just trying to control their weight or have more energy, having stable blood sugar levels are important for that. So I think it helps not just people that are struggling with prediabetes or even diabetes. It just helps anybody to have something simple. Most of the nutrition plans out there, in my opinion, they complicate nutrition. You have to count this, weigh this, measure that. You can have this, you can't have that. You have to have this. You can't combine these foods. People come to me, and they have all these rules in their head because they've taken a piece from this diet and a piece from that plan, and the coworker that told them this, and somebody else told them that. They read this in a magazine, and they have so much complication and confusion in their head. And so when we can step back and say, let's bring some of the joy back to eating, get rid of some of these rules, and just simplify it, it becomes much easier.
I agree with you 100%. Because I have patients tell me, they say, like, what is it that I'm supposed to eat? Because it's so negative, the approach, And I tell my patient, I say, until you see Dina, if they are pre-diabetic, I say, we're going to take the starches, rice, pasta, bread, potato, and we're going to cut down by 50%. If they're just mild elevation, take the fruit and cut down on the fruit by 25%. And if you are eating 4 bananas, you're going to do 3 until you see Dina. If you were eating 2 loaves of bread, you're going to eat 1. 2 scoops of ice cream, you're going to drop down to 1 scoop. And it's very simple. So they go and they say, okay, whatever I have in the refrigerator, you can start your diet that day. And then I say, because I'm not going to spend a whole hour on my exam room with the patient. I say, but Dina can do that. She can spend a whole hour with you. And she can, the main problem with us as patients when we go to the dietitian is that we don't see the dietitian as we see the coach or the trainer we have at the gym. You cannot get a trainer at the gym and tell you, okay, do so many repetitions of this one, and that one. I see you in 1 year. They have to follow up with you. Okay, you're going to do upper body, lower body. So the dietitian really become your coach. And when you see the dietitian, don't go there to just, she's trying to get to know your way of life. And you are trying to get to know her approach to whatever we are trying to accomplish in your case. And then you follow with that person. And we see the progress. We follow the BMI. We follow all these parameters. And, I read Dina's and Courtney and Nicole notes. And they are very thorough. They go through so many things during that 1 hour. It's a worth spent time that you have with your dietitian.
So, Dina, I think most of the problem is just like we all live such busy lives.
Right.
And it's so easy. That's why fast food restaurants have done so well, because you just drive in, you get food. But even at home. Mm-hmm. And so I figured out a lot of things. I prepare things, put them in little baggies, and I just run and get it. Now, I have been on the cookie diet, from a lot of times. Mm-hmm. And those cookie diets, it's a special one that we've, I guess you know about. But what that does for me, too, is I don't stop anywhere then. If I'm hungry, I just grab one of those and I have it. Mm-hmm. Because that's been the problem. I don't know. You have children or family?
I do. I have 2 small kids, 4 and 6. So.
Oh, okay. So then
Life
you are
is busy.
Yeah, it is busy. And we wonder how we're able to do everything. And food is comfort and food is other things. So tell us more about this PF3. What is the fat that you think about?
So when I go through the list of the different categories with patients, I divide them off by best, good, okay, and better have a good reason. So I don't want to necessarily call any food bad because then we start to create this negative relationship with food, and we're trying to change this to a more positive relationship with food. And a good reason could be that you really like the food, right? What I'm looking for is trends where people are having a good reason all the time. First it was they didn't get to the grocery store, then they were busy, then they were at a party, then, so then we can look at the behaviors. So when I'm looking at that fat category, up at the very top of the list, the most healthy fats are going to be whole food fats, meaning it is completely unprocessed, but the primary nutrient is fat. Pretty short list. Nuts, seeds, avocados. I do include olive oil up there. And then, down the list is what I consider still good to have, but things like nut butters, peanut butters, maybe nuts that are roasted instead of raw. So obviously the raw and salted are going to be healthier. So as you go down the list, and then towards the bottom, you're going to see things like sour cream and mayonnaise and maybe the less healthy items, but I don't want to say don't have them. I just want to see people more often choosing from the top of that list. So this is a bit less of a restrictive approach, but we're still keeping that balance because every meal or snack has a protein, a fat, and a fiber.
Well, I have you here. I'm going to ask you. So coconut oil is what I use. Is coconut oil good?
Coconut oil is an okay choice. It is not as beneficial as most people think that it is. It is high in what's called medium chain triglycerides, and the saturated fat that is in it is processed different than other saturated fats. So it's considered to not be as damaging as most of the saturated fats that we have out there. It's an okay choice. It's not as beneficial as people think, though.
And it's interesting because olive oil, I used to always cook with olive oil, but they say it doesn't have as high you can't cook with it as easily.
It's not as heat stable. But if you're cooking on your stovetop at a medium heat or even slightly above medium, it's not going to come close to reaching the smoke point. So you're still safe to use olive oil.
Yes. I love olive oil.
Yeah.
Now, coconut oil is good for the skin. If you have any skin issue, coconut oil, essential coconut oil, pure coconut oil is excellent.
That's your Hawaiian stuff.
Yeah, that's true.
Yeah.
And in Hawaii, they take the coconut oil, you take a little bit, and you rinse your mouth with, and it's antibacterial. Don't swallow it, just rinse and throw it out.
Is that right?
Right.
The other thing to consider is variety. I think you can do both. You don't have to do one or the other. I cook with coconut oil at home sometimes, especially if I'm cooking a dish that's going to taste really good with a little bit of that coconut flavor. Other times I use olive oil. When we get a variety, just like people ask me, well, what's the best nut? What should it be almond? Should it be walnuts?
I'm the best nut. I'm the best nut,
right? The answer is to get them all because they each have a unique component about them that's beneficial. So do some olive oil, do some coconut oil. That's fine.
I just recently read about that because I do eat a lot of natural nuts. I never buy the ones that have that are roasted. But I didn't know pecans were so good for you because I thought walnuts were the best. But pecans have great, great health.
Right. Yeah. Each one is very unique. I mean, walnuts get a good rap because they're the highest in omega-3s. But then you go to something like a Brazil nut, it's very high in selenium, which is an antioxidant. Almonds have been shown to help reduce cholesterol. I mean, you're going to get a benefit from all of them, so eat them all.
Yeah.
But how much? How much would you eat?
So that's the problem.
I consider a portion, when I'm going through my PF3 plan with patients, I consider a portion to be 2 tablespoons. So, and depending on somebody's calorie level, their activity level, I will generally, most people fall into 1 to 2 servings of fat per meal and 1 serving of fat for a snack. So, for example, if you're going to eat a piece of fruit for a snack, which is healthy, but I don't want to see them eating the fruit by themselves because that's just carb and fiber. We're missing the protein and the fat. So if we can add to that piece of fruit a handful of a couple tablespoons of almonds or maybe a piece of cheese, which has a little bit of protein and fat, then we're balancing that out so we don't get as much of a glycemic spike from that fruit.
Oh, that's very nice. It tastes better, too, if you're having a nut with some fruit.
It's more satisfying, too.
And the cheese.
What? And the cheese. Yeah, cheese. You have to
with
be careful
the
about
red
that.
wine.
Now we're really getting into this whole thing.
Oh, we're getting sexy here.
We're getting not only sexy, we're getting drunk. No, I'm kidding.
It's 5 o'clock somewhere.
Yes, right. 5 o'clock somewhere. That's good. But go back to the what you were saying was protein. Give me the best. So the proteins, of course, are nuts. They're fats, but they're nuts too, aren't they?
I count those as fat because if you look at their nutritional profile, there's a lot more fat in them than there is protein. So to keep things really simple, I just look at the primary nutrient, what it's highest in, and that's the category it goes in. Mm-hmm. So if you happen to also get from the nuts fiber and protein, that's just an added benefit, which is also the reason why it's in the best category.
In the best, right. Well, talk about protein. So you said protein, fat, and the fiber. So why don't we cover a little bit what would be your best protein?
So your best protein, this is a bit of a tricky topic because, in my opinion, a lot of the protein sources we have in this country in general are not the greatest because of the way that our agriculture is run. So the animals are being fed a lot of things that...
A lot of chemical, a lot hormones.
Right. And so if you can get meat products or poultry products or eggs that are organic, beef that's grass-fed, that's going to be healthier because it's closer to the natural way that animal is supposed to survive and closer to the diet that they're used to eating. And it does make a difference. And we know that grass-fed beef has a better fat profile, particularly higher in what's called CLA, which is supposed to help with fat metabolism. So it really does make a difference how the animal is raised. So those are going to be your better choices. I totally understand that not everybody's going to be able to do that. It is very expensive to eat those types of foods.
That's why I want my farm.
Yeah.
I want my chickens.
Yes, chicken.
I want chickens in my
eggs.
That's right. Well, I'm very careful. I always buy when I buy eggs because I crave eggs, but I always buy the ones that are the very best. They have the omega. They have omega, but they're cage free and they roam and whatever they do.
Right.
But
and get my paso fino, and my paso fino don't step on the egg. then I have scrambled eggs.
Oh my gosh.
But let's get into eggs. So now, is this a bad thing to have an egg every day?
Absolutely not.
Oh, I love her already.
Right.
Thank you for bringing Dina here.
Yeah, there's actually a lot of nutrition in the yolk. And, as a nutritionist, dietitian, I've been saying for years, please eat the yolk. You're getting a lot of nutrition there. And the fat helps to keep you satiated or full. So you want that fat. Eat it like it's meant to be eaten. And just recently, when they released the 2015 dietary guidelines, the government, they finally caught on board and said, okay, we're going to lift that restriction on eggs. Even though, the nutrition community as a whole has been recommending them for years, but it always takes a little bit of time to catch up.
Some people don't like boiled eggs. So what will be your recommendation?
Oh, well, you can scramble them. You can pan fry them. I love my misto. If you've ever used a misto, it's a little pump sprayer. You can put olive oil in there, coconut oil, and you just pump it, and then you can spray your pan.
Mm-hmm. Okay, well, I make an egg souffle. I have to tell you what this is. I take my egg and I beat it up, and I take some maybe cottage cheese or a little bit of something, and I put it in a little coffee cup, and I just put a little top on it, and I put it in for 1 minute into the microwave, and it comes like a souffle. Now, sometimes I throw a little tomato in it. It's fantastic.
Yeah.
But you know what really pains me is that so many people told you, okay, it's too much cholesterol, so you just eat egg whites. Now, when I used to have to take my egg and take all the yolks, and it went down into the drain, I said, I have got to be able to do something with those yolks. They're too beautiful.
You should have been giving them to your dog at least. It's good for your dog's coat. Yeah.
I didn't know that.
Better
but
for
now,
you.
Now I'm not. Now I eat them.
Good.
But it's funny how he does love egg, and I do give him a little piece of the hard-boiled eggs.
I eat them too because it's good for my coat.
But it is good for your coat, right? That's right. When I wrote the article for the new spa that we haven't talked about that yet, and I guess we may not be able to do this, but they do have, Dr. Mencia has ventured out now, and he's purchased a wonderful spa, now it's a med spa, which is called Stonewater Spa, and you'll see it. There's a whole article coming up in December. But I think that maybe we have to do something about the diet, have a nutritionist there also.
Absolutely.
Because usually you don't see that in a med spa.
Med spa.
Because here you see these people doing all these things, and your face is gorgeous. But it didn't come casually. And maybe having a nutritionist even a few days a week, then maybe she has to do a little cooking and a little cooking class. I'm really getting into this. I'm giving up what I'm doing. I'm going over there.
There you go.
That's Dina and I. Ina and I are going to do this, right? Yep. But I'm glad you told us about the eggs, because that's been a big misnomer, hasn't it?
Yes, absolutely. I still see people that come in eating egg whites and thinking they're doing good, which, not that there's anything wrong with the egg white, particularly if you prefer that. I don't want to take away make somebody eat something they don't like.
They don't prefer it.
But most people don't prefer it. Yeah.
It's because of the cholesterol. But let's go then into, so let's just say an egg is good protein. What else if you're fast in the morning? I mean, oatmeal is fiber. That's not.
Absolutely.
Right?
You're a quick learner.
Yeah.
So, oatmeal is healthy. It helps control cholesterol. So a lot of people will say, oh, well, I eat oatmeal for breakfast. That's a great breakfast, which it is a healthy item. But I like to look at the whole picture. So have a smaller bowl of oatmeal than what you would normally have. Add some nuts on top for some healthy fat. And then on the side, you can grab a string cheese. You can have a hard-boiled egg. You could do a Greek yogurt. Then you have that complete meal.
A little flaxseed.
You could do flaxseed instead of nuts,
seeds.
or
He's taught me all about
chia
flaxseed.
seed, which is also really good. Chia seed?
What?
Chia seed. Like
seed.
The
pet.
chia seed, CHIA, the one that you grow grows a plant?
Yeah.
And you're eating the chia seed.
Chia
I have
seed,
never eaten chia seeds.
Yeah, so they're very high in soluble fiber, and which is good for cholesterol management. You have to be careful, though, because I've had a few of my patients come in to see me, and they're eating so much of the chia seed because they heard it was healthy. It's also high in antioxidants. It has some protein in it, and it can give you a little bit of a tight feeling in your stomach. So, I tell people, start with a tablespoon a day and, see how you do. Or if if it's causing any kind of cramping, maybe do half flaxseed, half chia seed.
Chia seed. Now, that's the first time we really discussed it, but I would think that...
Just add some water and chia seed.
Yeah, but you know what the problem is? They also probably get into your teeth.
They do,
I was thinking about the chia seed as compared to...
They make really good pudding, too, because they're very gelatinous from that soluble fiber, kind of like a tapioca.
Oh.
It's almost like a tapioca pudding. Yeah, you just take some almond milk or even regular milk and put the chia seed in there, let it sit for a few hours, and my kids love it.
Not even cooked? It's not being cooked or
No,
anything?
not cooked at all.
Wait, this is a great recipe. So do that again for me, for everybody.
So
we get chia seed.
So the ratio that I use, and you can adjust it depending if you like the pudding a little thinner or thicker, but the ratio I use is 1 cup of milk, whether it be regular milk, almond milk.
Okay.
I'm going to tell on myself, I use the chocolate almond milk when I make it for my kids. A little bit of sugar, but it's a treat.
It's okay.
And
it's great for the kids.
And then I add 3 tablespoons of flaxseed. I'm sorry, chia seed.
Chia seed,
yeah.
Right? And all right, now what do you do with it? You mix it up.
You just mix it up really good and then set it in the refrigerator for 3-4 hours, and it gets thick, very thick.
And that's healthy.
Yeah.
Is that the protein that we want in the morning?
Well, if you do it with the milk, that'll get regular milk. That's going to give you more protein. Almond milk is actually very low in protein.
But if we use fat-free milk, can we still do it with that? With the chia seed, will it still do the same thing?
It'll still do the same thing, yeah.
Right.
Yeah.
This is great. We're even having a little course in nutrition here. I mean, as far as food, this is a wonderful thing. I think we have to maybe put that. Maybe we're going to do an article, and then we'll do some of this stuff in it. So when you have your patients, and Dr. Mencia is working with them, do you have these little recipes that you give people?
I do, yes, I do. One of the favorites, speaking of breakfast, and this is my kids' absolute favorite, is what I call PF3 pancakes.
Oh, wonderful. That sounds good for me. I love pancakes.
One of the easiest things to make. You take 1 banana, 2 eggs, and 1/3 cup of dry oatmeal.
Really?
And you put it in a blender. I usually put some cinnamon, vanilla, maybe just a little pinch of light salt, and blend it up, and you have your batter. And then if you want to put some fat in there, I just put some almond butter or peanut butter on top of the pancakes.
Oh, I love it. Well, this has been wonderful. Dina Garcia. And this is, of course, I got to give everybody information. The AGI Medical and Dental Centers are going wild. Fort Lauderdale is 954-489-1345. And Boynton Beach is 561-270-6494. They're open on Saturdays, as you can see. Dr. Mencia is always there, runs out of here for Saturday. Home visit services are available. And now we have this wonderful nutritionist, Dina Garcia, who's going to tell you about, I've got to have that PF3 pancakes. I'm going to try that. I wrote the recipe down. I love it. What am I putting on for the liquid on top? I can't use maple syrup, I know.
Well, you can, right. I like it with just almond butter or peanut butter because the pancakes are just a touch sweet with the banana.
Right.
But if you do want something sweet on top, take a bag of frozen berries and put them in a little saucepan and just kind of smash them and cook them. And then you can pour that on top.
You're good. Cool. This is fantastic. We really had it. Well, thank you very much, Dina. I look forward to seeing you more often and getting some of these recipes. That's what we ought to really do, I think.
Excellent.
Do some of the little recipes for the next article on nutrition would be really wonderful.
Dina is the practice in Fort Lauderdale.
Okay, in Fort Lauderdale.
Every Thursday.
And you see what's nice?
And one Saturday a month.
One Saturday a month, starting
but the
in
one
January.
Thing that we have to say is this is probably the only kind of a medical office where you can go and have a nutritionist, and it's all part of the Medicare.
We try not to push too much medication. So we really, you cannot say you gave the patient a chance if you don't have the support system.
You are wonderful, Dr. Mencia, and we are out of here. Thank you very much. I can see you at the spa and see you at the AGI Medical Center. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.